Welcome to this explainer. Today, we're unpacking a side of healthcare that most of us never actually see, but one that literally impacts every single patient. We are going to break down the incredible back-end machinery that makes modern healthcare data so powerful. So if you've ever wondered how a massive hospital knows exactly what resources it's going to need, or how your personal medical records stay organized and totally secure across a dozen different departments, well, you are definitely in the right place. Let's get into it.
Okay, let's start with this foundational truth from the text. The world is run by data. No decisions can be made without them. You know, in healthcare, this isn't just some catchy business motto. It's honestly a matter of life and death. Health information management professionals are essentially the stewards of this truth. They rely on incredibly high-quality, pristine data to drive every single medical, financial, and operational decision. Without clean, accurate data, the entire system is basically flying blind.
To really explain this chapter in detail today, we're going to follow a fascinating journey. We've got 6 main stops. We'll start with the power of analytics, then head inside the database system, look at dictionaries and metadata, standardizing medical vocabulary, blueprinting with data models, and finally wrap up with the relational database model.
Section 1. The power of analytics. Let's zoom out and look at the big picture of how examining raw data actually translates into saving lives. Think of data analytics as happening in 4 distinct stages. First up is descriptive analytics, literally just asking what happened. This is like looking at frequency distributions to spot which populations were most at risk during the COVID-19 pandemic. Second, we have diagnostic analytics. Why did it happen? If patient volume at a clinic suddenly drops off a cliff, diagnostic tools help us figure out if, say, a key physician just left the practice. Then there's predictive analytics, what will happen. This is basically a medical weather forecast. We use historical data to predict things like hospital ventilator demand right before a massive hurricane hits. And finally, prescriptive analytics, what should we do? This takes all that previous data and suggests a concrete strategy, like how to best plan mitigation efforts for the next major health crisis. Now, what's really cool is the ultimate goal of all these complex activities. It's a transformation process. Data turns into information, which becomes knowledge, and eventually that crystallizes into wisdom. And in healthcare, that wisdom is pointed directly at what we call the triple aim: improving the patient experience of care, reducing the per capita cost of care, and improving overall population health. A perfect everyday example of this is a patient portal in your electronic health record. It uses data to speed up your scheduling and deliver test results faster, directly improving your personal experience. So a really crucial takeaway here is understanding the fine but very definite difference between 2 terms you probably hear thrown around a lot: health data analytics and health informatics. Analytics is the science of the numbers. It's manipulating that raw data to find hidden trends in medical diagnoses. Informatics, on the flip side, is the application of that information. It's taking those insights and building the actual technology and systems to deliver better care on the front lines.
Section 2. Inside the database system. Because to do any of that brilliant analytics, we first have to gather the data into one place.
Now, a massive database is essentially a giant paperweight without a database management system, or DBMS. Think of the DBMS as the operational brain of the whole show. It's the software that manipulates and controls everything. It ensures that hundreds of users can access records at the exact same time without the whole system crashing. It manages transactions so half-finished data isn't accidentally saved. And crucially, it acts as the bouncer, providing incredibly strict security mechanisms to keep unauthorized eyes off your personal health information.
And to actually get answers out of that operational brain, we use queries. Think of a query like a detective interrogating the database. You can use natural language queries, which is basically typing regular words like list all patients discharged today. Then there's query by example, where you just point and click on the specific fields you want. And of course, there's SQL, or structured query language. That's the heavy-duty, standard programming language database administrators use to manipulate and pull data on a highly technical level.
Section 3. Dictionaries and metadata. With millions of queries firing off every day, how on earth is order maintained? You will constantly hear metadata casually referred to as just data about data. But honestly, that oversimplifies a really vital concept. Metadata is the structured information that makes data actually usable and trustworthy. Think about an electronic timestamp showing exactly when a record was created, who opened it, and if they changed anything. If there's ever an information breach investigation, this administrative metadata is exactly what investigators use to prove a record's integrity. It is the undeniable, tamper-proof digital footprint of your health record.
To make absolutely sure there's consistency across an entire hospital network, organizations rely on a data dictionary. This dictionary sets the absolute rules for how data gets entered. It dictates that a last name field has to be text, and a date of birth has to follow a strict month, day, year format. It even uses these clever things called masks, so if an admissions clerk quickly types in a 10-digit social security number, a mask ensures it automatically displays on the screen with the proper dashes, no matter how sloppily it was typed. It's all about eliminating messy data.
Section 4. Standardizing medical vocabulary. Once the structure is in place, we face another massive hurdle: language.
Medicine has an incredibly complex language, and doctors use tons of synonyms: therapeutic versus curative, or drug versus medication. For a computer trying to pull accurate records, synonyms are a total nightmare. Enter SNOMED-CT. This stands for the Systematized Nomenclature of Medicine Clinical Terms, and it is an absolute game changer. It solves the synonym problem by assigning unique, meaning-based codes to diagnoses. It contains over 352,000 concepts. So behind the scenes, no matter which specific word a doctor decides to type, SNOMED-CT ensures the computer categorizes it perfectly.
Section 5. Blueprinting with data models. With standardized language, we need to map out the connections.
Before you build a house, you need an architectural blueprint, right? Well, in database design, that blueprint is called an Entity Relationship Diagram, or ERD. It visually maps out how different entities, like a person, a room, or a piece of equipment, relate to one another. The simplest version is a one-to-one relationship. Think of one single patient mapped directly to their one specific attending physician. Nice and simple.
But let's be real. Actual healthcare is incredibly complex. Databases have to be robust enough to handle many-to-many relationships. Picture a single patient in the ICU. They might see a cardiologist, a neurologist, and a pulmonologist. That's one patient to many doctors. And every single one of those consulting doctors is also seeing dozens of other patients. Data models ensure the database can untangle and track this massive, overlapping web of interactions without breaking a sweat.
And finally, Section 6, the relational database model. Let's zoom all the way into the actual storage structure used most often today. Before data even gets to rest in the database, it goes through a critical process called normalization. This just means breaking data elements down into the smallest useful pieces. For example, if we don't separate a patient's city and state into different fields, the computer gets totally confused. The tiny town of Opp, Alabama looks vastly different to a computer than San Luis Obispo, California. By normalizing that data, breaking city, state, and zip into their own distinct boxes, users can effortlessly run reports, searching by specific regions in seconds.
Once the data is normalized, it's stored in tables that look a whole lot like a spreadsheet. You have your predefined data fields acting as the columns, things like first name or date of birth. And when you read horizontally across all those columns, they lock together to form a complete record, or a row. That single row represents all the collected, organized data for one specific patient. Now, what is the glue holding all these different tables together? It's the key system. A primary key is a unique identifier for a record, like your unique patient ID number. The brilliant part is, when your primary key is dropped into a completely different table, say the pharmacy billing table, it becomes what's called a foreign key. This allows the database to securely and instantly link your personal identity to your medication costs, without anyone having to retype your name, which drastically cuts down on human error.
When you understand these foundational building blocks, from primary keys to metadata to SNOMED-CT, it completely changes how you view medical data. You start to see how raw, fragmented numbers are actively transformed into powerful, prescriptive intelligence that literally improves care and saves lives. It's kind of wild to think about, right? With millions of these interconnected systems quietly humming away at this very second, what massive new medical breakthroughs are hiding in our data right now, just waiting for the right query to discover them? Something to think about. Thanks so much for joining me on this deep dive today.